Good morning, everybody. This is the same presentation I give at a variety of dental schools all throughout the year. I figured this whole company is not about hiding information, safeguarding information. It's about disseminating the information to you all. So I just wanted to get a version of it out there for you guys. Feel free to throw your questions, comments, concerns in the comment section, and I will, of course, reply to those. If you have a specific concern, you can reach me on my website or my Instagram and send me a direct message. The website is www.theeducatedAssociate.com, just like you'll see all over this page. So feel free to find me there. I am Dr. Tony Schichtons. I am a licensed dentist. I practice in Arizona, and I am the founder of The Educated Associate. Just a touch more about me, graduated in 2021 from the University of Colorado. At that time, in the bottom corner there, you can see I graduated with a huge amount of credit card debt. So if you're a doc that's in school stressing about debt, I ended up getting married, having a surprise child, racked up a ton of debt, moving around. You can get through these problems. Ever since graduating, I've created this company. I've authored a book about how to land your dream dental associateship. You'll see that presented throughout today. And I've personally, with my company, reviewed over 100 associate agreements. So I've worked a lot of these agreements. I've reviewed a myriad of agreements. So we have a pretty keen understanding of what's going on out there in the dental associate landscape. Right from the jump, I think there are three different avenues that you can think of when you're thinking about finding an associateship. They're kind of the three baskets, if you will. There's two that are fairly similar. That is a private practice and a DSO. A DSO is a dental service organization. Think of that as corporate. In my writing and in this presentation, you can think of private practice as a setting where the dentist actually works in the office. You have the dentist working there. What, guys? What? Sorry about that, everybody. Trying to do this with my kids around. So, just to jump right back in, a private practice is where the owning dentist actually works in that specific clinic. So, in my opinion, a private practice owner can have one, two, maybe three clinics, more than likely just one or two. A DSO, this can be owned by anybody, a dentist, a private equity group, a lot of different things. Now, nonprofit, this is government. This is the government paying you. So there's two main ways you can get this. That's teaching at a dental school, so as an educator, or at a hygiene school, or alternatively through FQHCs, federally qualified health centers. These are low socioeconomic areas. You're going to treat underserved patients. And here are five different areas that you can kind of think about these different baskets that you can drop into. So right off the jump, earning potential. I know I have private practice listed as slightly greater than DSO. Really, the sky's the limit in both those two clinic styles. You can earn as much as you produce. In a nonprofit setting, vastly different setup. You will earn less money. You will be earning a salary. You will work a specific number of hours. So in the next section, you'll see the weekly hours. You're going to work probably 8 to 5 Monday through Friday in that nonprofit, but you're going to see less patients. So that funnels us down to the third one. There's two different ways you can think of how much you're working, how many hours you're physically at work, and how many patients or how many procedures they're squeezing out of you in that time while you're there. In a private practice in a DSO, you're going to see high patient volumes more often than not, or high procedural volumes more than not. So in those settings, you're going to be working hard. Maybe not quite as many hours as a nonprofit, but your work hours are probably going to be much heavier. Number four there, provider satisfaction. This was all dentist survey data in the pre-pandemic world. I obtained these things from like 2021. So you have to take what that means to you. Is provider satisfaction data from pre-pandemic important? I'm not so sure. But at that time, there was a clear predilection for docs preferring nonprofits. So docs were much happier when they were in nonprofits when compared to private practices and DSOs. Last but not least, probably the only hard stop on this page. If you like technology, you can rule out nonprofits. I have a buddy that worked at a nonprofit, no Pano, no digital x-rays, certainly no CBCT, iTero scanner, anything fun like that. So if you like tech, you can rule out nonprofits. This is a concept I wrote about heavily in my book. I'm also grateful that I kind of was able to see how AI was going to be dropping into our lives, and especially with the job searches. So what the resume funnel is you're going to create two different documents: a very simple and AI readable resume, and a much more specific tailored CV. So all these job websites, Indeed, Glassdoor, you name it, they're basically using AI to play dental practice matchmaker. It's taking job applicants and comparing them to what the job postings say, mixing them up, seeing where the best fits are. So you want to create a simple AI readable resume. All it really needs to say is who you are, that you're a dentist, that you want to work in a specific area, and maybe what procedures you like to do. Other than that, you don't need to tell it about your communicative skills. You don't need to talk to it about how you're good with anxiety, with anxious patients. You just need to let the AI know that you're a dentist in this area and you do this. Let it match you with an office. At that point, an office manager, an owner, a regional director, a hiring manager, somebody like that is likely to reach out to you directly via email. This is the chance to deploy your multi-page, very specific to you CV. This is where you can tell them all that fluffy stuff. I'm great with anxiety. I did XYZ in dental school that made me great with a scanner. All those more specific details, that's when you can dump those in. And at that point, that's when I believe your already pre-matched skill sets and your excellent CV should line you up for a job interview. Right here, these are just 5 very common red flags that I see in job postings. So associates should wear multiple hats. What does that mean? It means you're going to be doing things outside clinical dentistry. That's not always bad. Not every associate hates that, but you will be doing things that you're not getting paid for. Number 2, kids are home on spring break, so I'm trying to get these things out to you all while I got the kids here. Got a picture of the daughter here on the screen. Number 2, we're family. The family comment typically means that there is some uncovered, there is some sort of workplace fight. You got disgruntled workers. There's something they're trying to mask by saying we're family. Whenever they say we're family, it pretty much guarantees that there is some sort of office drama that is unresolved, and you will be dropped right into that. Number 3, rock star. What the heck is a dental rock star? 5 years out of school, I place implants. I do selective molar endos. I'm certainly still not a dental rock star. I have a hard time believing many new graduates can be dental rock stars. So if they're asking for a rock star in a job application, probably time to run away. You're never going to live up to those expectations. Number 4, I've lived this one, worked at an office where multiple family members were on staff. What I quickly learned is while I was often the only dentist there, I was below the family members in all decision making. So if you want to have any decision-making potential, don't plan on working with other owners' family members. They will always be picked over you. And if a fight ever arises, you can guess what side the owner will go for. Last but not least, seems obvious, but we're in a heavy review-like world. So find your owner, find your corporation on Google, find them on Yelp, find them on Facebook, see if they're getting combative on comments, see if they're getting combative on reviews. Obviously, if they're willing to get combative in these open forums, they're absolutely going to get combative with you behind closed doors. Right here, really points 1 and 3 are the main takeaways from this side, and they're what my company is designed around. I feel very, very strongly that associates should understand every word of their agreement. And if you understand every word of your agreement, that means you will know your exit strategy. So sometimes there was a signing bonus. And if you leave within a certain specified time, you owe them money back. That's a financial clawback. Sometimes you have non-competes that will restrict the distance or the time frame for which you can employ previous workers, or where you can no longer work in a certain radius around that practice. So you need to know all of that in order what you would need to do to get out of the associateship, start a new job. And if you know your exit strategy, you will sleep much easier at night. My book talks about a systematic approach to evaluate your contracts so that you don't miss anything. And we'll hit a little bit more on that as we go through. I remember walking the schools of the halls of dental school, sitting in the sim clinic, prepping my number 3 for the 100th time, practicing and hearing docs around me talking about their job offers. Well, I'd hear people saying they got a job offer for $200,000 in Kansas and $300,000 in Honolulu, Hawaii. Everyone was just bragging about their overall compensation, but nobody really was thinking about it through the lens of what that income could buy you in these various areas. So I created this free calculator tool. It'll allow you to really see what that income would allow you to purchase in that area. So you can see here the reality. 200K in Kansas is really like $250,000 of purchasing power in the average US city, while $200,000 in Hawaii is really like only $106,000 of purchasing power in the average US city. So obviously you need to get paid way more in Hawaii than you would in Kansas to buy the same amount of stuff. The solution is making sure that you are selecting an area that aligns with what you need to have to live. Scan the QR code. It'll take you to my website. You can use that tool for free. Just really out there to help you. This kind of goes back to the previous slide about contract negotiation. This is something I will help you with. If you don't want my help, at a minimum, buy the book Never Split the Difference by Chris Voss, expert FBI hostage negotiator. I read this book like once every year or two, and it really helps me instill new negotiation strategies, new tactics. It's not going to give you nitty-gritty details about how to negotiate your contracts. I can help you there, but this will teach you an overview on how you can negotiate terms. This is another thing I had brewing up in my mind back in dental school. So this is another free tool I created. It's my total compensation calculator. Same thing. I remember people talking about $200,000, $300,000. They were only looking about the specific income that's going to be hitting their bank accounts. They did not think about all the benefits that could be basically saving you money that you don't have to pay for things. So if you're not having to buy health insurance, that's something you're not spending money on. So that is kind of a benefit, and that's an increased income to you. There's 401ks. There's a myriad of these things. So again, use this free tool to ensure that the offer that you're selecting truly is a good offer for you. It has a good overall total compensation. Just a quick screenshot, another QR code for the same tool here, but you can just see basically a brief look on what it is. It'll allow you to compare multiple offers so that if you only care about income, this tool will allow you to ensure that you're picking the offer with the highest overall compensation. I don't recommend that that's how you base your decision solely, but if that's all you care about, this will help you make that determination. I remember sitting in my school D4 year thinking about graduating, boards. My last had to pass my FDP practical. I needed to eliminate my credit card debt that I alluded to. I wanted to start living my life. I saw job offers coming in, but I didn't have the time or energy a lot of times to review those agreements in detail. I end up working with a lot of docs that sign their agreement in under 2 minutes. It's like a 15-page document. There's zero chance they read it, and they realize they don't have the $1,000 to $3,000 that most attorneys will cost to purchase a contract review. So we created a very cheap service. It's $297. And what I'm going to do is review your agreement, let you know about any and all red flags, green flags, all that good stuff. We'll let you know about the benefits, the total compensations. We'll answer any questions. And the main takeaway is the negotiation strategy call. I'm going to get on Zoom with you. We're going to sit there. We're going to go through line by line how we can make the agreement align with who you are as a doc. You will end that Zoom meeting knowing and understanding every word of the agreement, knowing and understanding your exit strategy. And I can guarantee you, we have a money back guarantee that I will find, negotiate, or provide at least $300 of value. If we do all the meeting and everything and you don't think that I provided at least $300 of value, I'll send the money right back to you. So feel free to scan the code and book a review. I mentioned the book a couple of times throughout today. Feel free to grab a paperback, hardback version on Amazon or an Audible version on Audible. I'm obviously an Audible guy, so feel free to use that. If you don't already, you can follow me for more daily advice on Instagram. So this QR code will take you to my Instagram. I provide more short-term daily insights in real-like form. Thank you all for your time this morning. Really appreciate it. Like I mentioned, write any questions below. And please use all the free services that I've created for you. Reach out with any questions, and let's make sure you get an agreement and an offer that you really like. I'll end this by saying not every associateship is perfect, but there is a dream associateship for everyone. So put in the work, put in the time, negotiate your contracts like you deserve, And as always, stay drilling, my friends.